Welcome to Marina Hills Animal Hospital Medical Moment. Today I wanted to talk about leptospirosis. Here at the animal hospital, we routinely vaccinate dogs against things that they're at risk for, and we separate our vaccines into two camps. There are those that we consider core vaccinations and those that are considered non-core. The core vaccines for dogs includes distemper and parvo, which is one needle that contains two agents we're protecting against, and rabies. Those are core vaccines for dogs. There are several non-core things that we sometimes vaccinate pets against if they're at risk. Leptospirosis is one of those. Leptospirosis is a spirochete bacteria. There are over 250 subtypes of this organism. There are about 10 different varieties that are important to dogs and cats, and we have vaccines against 4 of those. Leptospirosis is spread primarily in warm, moist environments through urine. And so if your pet goes places where wild animals may have urinated or where the soil is contaminated by urine, particularly if it stays moist for a long amount of time, that's the environment where lepto can easily be spread. It is a common problem in the Gulf Coast, Houston and that area. It is not common in Southern California because we primarily live in an arid desert. Having said that, there are cases which are known to be in the US, primarily coming up from Mexico, and more have been seen recently in San Diego. The organism is often transmitted by rodents like rats and mice. If pets are exposed to water or soil contaminated by rodent urine, that's how they can be infected. The organism can penetrate through cuts and wounds, or obviously if they drink contaminated water, that's how they would also be infected. When pets are infected by leptospirosis, the first thing that happens is that the spirochete bacteria get into the bloodstream and they invade the blood vessels, which causes inflammation of the blood vessels, leading to bruising, fevers, and petechial hemorrhages, so little bleeding spots throughout the body. Depending on which subtype of the organism is responsible for the infection, it will determine which organ system is most affected in the pet. Commonly, it is their kidneys or their liver that takes the brunt of the infection. Though in some forms of lepto, it can be other organs, including their eyes. Sometimes the infection is very sudden and severe, causing great fever and risk and sometimes death. Sometimes the dogs have a small dose of infection that they struggle with and it turns into a chronic condition. And those can appear in different ways over time. The bottom line is if your pet sleeps on the couch and drinks bottled water here in South Orange County, California, their risk for leptospirosis is very low, and I don't routinely recommend they be vaccinated. If, however, your dog is an adventurer and is out and about in the community, has a chance to go hiking, particularly in moist environments near the creek bed where a wild animal may have urinated, then they are at risk for leptospirosis and they should be vaccinated. And we have the vaccines here and we're glad to help protect your pet. If you have questions, give a call. The number at the office, 949-495-2224. This has been a medical moment for Marina Hills Animal Hospital.